Hello. Oh, it's so lovely, bright up here. I don't know how I'm going to follow that one. That was beautiful, and so many beautiful speakers today, so hopefully we can get some interesting things out of the way. I will say I can't own up to everything in my bio. I'm actually not a psychologist. That takes a lot of love for people. It's not that I hate people, okay? That's a lot of love, though. So let's move into what we are here to talk about today. So I don't have, I'll wait for this slide. So I don't have any disclosures, but I want to start with really the ultimate question about who am I, right? What gives me the credibility to stand up here and talk, even though I don't necessarily have the love for people psychologists have. I do try. So my name is Dr. Darby Dickton. Even professionally, I go by Dr. Darby. This is the version of me that almost everyone sees day in, day out. I generally don't go by Dr. Dickton because there were too many jokes about me not being a urologist. So I'll leave that there. Now, more importantly, in my life, I am a wife, I'm a mother, and I am a daughter. These people have spent thousands of hours with me at my bedside as I've undergone my own patient-sided issues. So I initially trained in the Air Force, and I was at UC Davis, first as a general surgery intern and then emergency medicine. In my third year of training, I actually got very sick. So in about 6 weeks, I went from completely fine with obviously that Ehlers-Danlos, like weird, history, sketchy, but never diagnosed. Although in medical school, I was like, you know what, I think I have that. And I wasn't that person, but of course you don't listen to medical students when they diagnose themselves, which is good, you shouldn't. So anyway, I came into it, and in about 6 weeks, I went from completely normal functioning to actually in a wheelchair, couldn't walk, couldn't think, couldn't really talk. But it developed through dislocations. And Ehlers-Danlos doesn't do that, right? You don't go from completely healthy to completely dislocating. That's not a thing. There was some discussion about, well, was I the first autoimmune Ehlers-Danlos? No, definitely just Ehlers-Danlos. But it was actually a sort of offshoot of Guillain-Barré or CIDP, which is a muscle weakness. And so for me, because of the Ehlers-Danlos, it actually manifested as dislocations rather than muscle weakness, which put me in a little bit of an interesting slide into my health stuff. I was trying to come up with one story that could really summarize my patient experience. It's been over 5 years now. This last year, I had my beautiful baby girl. I showed up because obviously Ehlers-Danlos makes people nervous, right? I had this amazing 96-year-old OB-GYN MFM guy who's like, no, Ehlers-Danlos, no big deal, we got you. And then he went on vacation the week I was due. So I show up to have my baby. They wanted to induce me because it was found that I had a clot in my heart during the pregnancy. So I was on blood thinners, but cardiologist was like, no, she can push. Still not sure why they scheduled the induction, but I'm scheduled, right? Like I'm 39 weeks, 4 days. I show up like, okay, I'm having this baby at 8 a.m. No, you can't have that baby. We can't do that. Like you aren't healthy enough to have a baby. Okay, so what's my option now, And so he actually refuses. He point blank refuses. And I had been having midwives. I'd insisted on midwives up to this point because I was like, I got this, I can do this. And he's like, no, you're too much of a mess. So they would sneak into the room and try to help me get started naturally. And then his shift changed, and thank goodness they started the induction. So they have me inducing. And during this pregnancy, things kept coming up, not related to Ehlers-Danlos. It was found that I had a phylloides tumor, which started growing 1 centimeter a week. So we knew that I was going to be getting a partial mastectomy the month after I had my baby. I had the clot on my heart. I had the Ehlers-Danlos. I had an autoimmune condition, meaning I was undergoing blood treatments every week. So it was a lot. And I think a lot of doctors just heard one of any 5 of those and kind of freaked out, which is fair, right? But I do think I would not have survived, probably literally, without my husband, for starters, because I tend to be in sheer denial when I'm losing blood. Although I'm also funny, which if I have time, I'll share those stories. Only when I'm dying, not as funny when I'm not dying. And the doctors would get so bogged down in 1 or 2 of these conditions, and as everybody in this room knows and everybody at home, when you have Ehlers-Danlos, your likelihood of 10 other diagnoses goes up 8, 9, 10 times, right? You don't get the Ehlers-Danlos diagnosis unless you're going to have a list of everything that comes along with it. And sometimes managing that huge list is where the burden is. And so I wanted to find a way to really break up that kind of monotony in the visit. So one of the things I wanted to touch base on is communication. Now, both when you're a provider and a patient, there are things that you're looking for and expecting. When I was a surgical intern, there was this doctor who, like, on surgery rounds, you're quick, right? You're just like racing through the hospital. He'd pull up a chair, sit down, hi, how are you? Good. Okay, then get up out of his chair, push it back, and leave. Because there was a study showing that if you sit down, your patients, like, won't sue you. And it worked for him. So people loved him. It was just something that happened naturally. There is an art to that. Being at the same level as someone, right? It really works. Now, these pictures are not bad body language pictures. You see the providers making eye contact. Not necessarily everything's going to be happy, so not every patient is smiling. They have the white coat, they look professional. But there's one glaring thing that you see in the next group of pictures. And when I've done some showing of these pictures to people over the past year, most people will say, I like the second group better. But a lot of times they can't really give you a good reason why they like the second one better. If you notice that in the first one, there's literally a physical barrier. The clipboard, right? The laptop, the papers. There is a barrier protecting you from the patient. You're not on the same side of the paper, you're not on the same side of the screen, you don't have it down. It's a physical wall. It is those little things that can make a really big difference in an encounter. So sitting down, not having something in your hands, it's not just about paying attention, it's an actual physical presence in the room. So keeping those things in mind, both as a provider and a patient, can be important. I picked this quote because I think that if you can acknowledge this, as a provider especially, you are going to be significantly further ahead in your care. Doubt is one of the names of intelligence. How many times have you been to a doctor and they will actually say, I don't know? And how many times would you have preferred that they said, I don't know? Right? They usually start with this like, well, it could be this or this or this, or, but I mean, you know, or I've seen cases, and they'll talk to you for 10 minutes longer than they should have because they're avoiding the I don't know. And the honest truth of any experience is that they don't know. I've had so many things in my own care that nobody could warn me about. And so I have this little algorithm. I had to come up with something memorable, right? And I was like, well, what do we all remember? Obviously, zebras. So I was like, okay, I got the zebra acronym we'll share, and hopefully everybody can pull something from it. So we have Zen, expectations, balance, real, ailments. And if you have a 5-step approach like this that guides you through the encounter, it'll usually hit everything, both on the provider side and the patient. There's a little bit of a different focus in here for each person. If you create an open, collaborative environment, you admit what you don't know right out the gate, that's going to help. Very few providers have actually seen or heard of Ehlers-Danlos, especially when you are new to the disorder yourself and you're going back to your primary care provider or somebody who's new to you. Saying I don't know right out the gate is okay. Understanding that people understand their own condition more is okay. I believe that as a provider, we're there to help people with their journey and educate where we can, not necessarily take it over or drive that ship. It's their life. We see you, 5, 10, 15 minutes in a couple months, and we think that we have a full picture. That's just not possible. And so we really have to cater it to that idea of helping. As a patient, this is a really good time to start setting your goals. I think 1 to 3, when you start to go more than 3, you're gonna get lost a little bit, and if you feel like you need to schedule multiple visits, I encourage that you call and you do that. Call the front office and say, you know what, I have a lot for 1 visit. Is it okay if I go ahead and schedule one for 2 weeks after that? And then have your goals for the visit so that you don't feel bogged down in too many details, especially when you're coming in for at least 3 different of the diagnoses on your list of 10, right? You want to piecemeal it because it's too much if you come in with a whole bunch of rare things at once. Or complicated things. They don't even have to be rare. It's just a big picture. In managing expectations, I think it's important to understand the difference between diagnosis versus treatment, and that these things are not possible most of the time. So when you walk in, the idea that you're gonna walk out with a diagnosis where you're like, oh, I can do something with that, I can make a plan, I can fix this. That's a fantastic long-term thought. I was never able to get that to work when I was having the dislocations now, when I was having the pain now. Having the diagnosis, yes, it's better than not knowing. I was actually about 5 years delayed in my diagnoses. But you have to take care of yourself, and you have to start now. Sometimes you don't have the luxury of waiting for the diagnosis, because the longer you wait, the longer you're just enduring. And nobody wants that for themselves. There's also a difference between cure versus supportive care. And we all recognize this one because there is no cure, right? You have a connective tissue disease. The question I've asked a lot of people that I still haven't gotten a response is like, so if I use that facelifting cream with the collagen, like, will that work? And nobody can tell me that one, because it's like, well, I guess my body can't use the bits, but maybe if you throw enough bits at it, some of them will accidentally be functional. I don't know. See, nobody can answer that. So finding things that support you in your journey is going to be more important than finding that cure that may or may not be 10 years down the road. Some of the speakers earlier this morning touched on, changing one thing, two things, not changing everything at once. And that's part of that supportive care. You need to know what is addressing your pain, not necessarily what's addressing your pain, but also giving you constipation and also causing you to throw up, right? I mean, we all know that run around with medications. This is a good time to narrow your goals down to just the one or two. 3 if one is small, because the goals are really important to stay consistent through the visit. It keeps you on topic rather than addressing the whole body at once. When you come into a visit and you have problems head to toe, it is a lot on a doctor to be like, hey, I've been waiting 6 months for this visit because you're overbooked, and now I have my knee and my hip and my eyeball and my ears doing that funny thing, and like this needs to be fixed now. That's a lot. And so I know, and it's terrible to ask, but if you can pick the 2 that real matter, right? Maybe the eyes and the ears, that one might be a good thing to chase. In the balance part, I think taking a mind, body, soul approach can be really helpful. Coping and social support is really important. I will say that as a provider, something that I've recommended to people in the past is being a little bit careful. Societies like this one are rare and beautiful, right? We are celebrating the journey of getting better together, finding solutions together. Some societies identify with the illness. And the problem that causes is that when you get better, you no longer fit in. And then where's your motivation? Like your friends, your support, the people you've gone to? Well, it's not that they don't want to know you anymore, but now it's kind of like not really fair, right? Because you got better. So there are societies out there who can get stuck in that divot. And I do caution patients about just checking in with themselves and making sure that they're in a position to better themselves and continually go forward with the groups that they're identifying with. And having groups that give them resources. I mean, the resources this has provided physicians all over the world is, just absolutely priceless. So finding things like that and holding on to them. At this stage as a patient, you can define your goal objectively. And by objectively, I mean numbers. You can't have it be abstract, right? Your goal can't be like, okay, I want to be able to run. It's not really helpful. Like, do you want to be able to run a mile? Do you want to be able to walk at all? I want to be able to take 3 steps, 5 steps. Put a number on it, because numbers you can track. If you say to yourself, you know what, in 6 months, I want to be walking, you're going to get there, and all of a sudden, what's going to happen is you're going to have elevated your bar, and you're not going to be happy. In your 6-month visit, you're going to be like, well, no, that's not really what I wanted. I wanted something different. And you have to give yourself those successes and those victories, because that's sometimes the little bit that you get is those victories. Now, the fact that these are real, this one touches home a lot for me, the daily impact. I had to get a port. I have blood treatments that I undergo every other week. I had a lot of people talk to me about a port. And I'd seen them, I'd felt them on patients. It wasn't really my area of expertise. If your emergency doctor is messing with your port, you probably have some other really serious issues. But nobody told me that hugs for the rest of my life would hurt. That is something that no physician, I think, knows. I've told a couple of them just as colleagues and as peers and as friends. They never considered that possibility. They talk about the seat belts and the purses. No, hugging. Hugging hurts. It causes pain. And that's not something, every order you place as a doctor, every medication you prescribe, it always has a downside, even when you don't know what it is, even when you can't fathom what it might be. There's going to be one. And that's why it's important, as a patient to advocate for yourself. Make sure you're saying, you know what, the doctor started me on that new medication, and yeah, it's helping that one thing, but it's causing new problems. Life is trial and error, and you have to communicate that, say, sorry, it didn't work for me. So these things are real. Remembering that they impact us every day, the depth to which they impact us as a provider, you will never know. You'll never understand it. But acknowledging the ignorance, right? I don't know. Saying that is so important. Just start right at the Zen. Sorry, I don't know. What can I do for you? What can I do to help you? I think that opens a lot of doors that otherwise wouldn't be opened. You can empower with education. Finding groups like this one that will give your patient information when you don't have the time nor the knowledge to do so can be really helpful. Keeping those in your back pocket, passing that on. As a patient, creating a goal timeline can be really helpful. Are you expecting to accomplish your goal in 3 weeks, 6 months, 5 years? You need to be realistic. It might take you time. I have things like, there's so many dances and walking and stuff I want to learn, And I'm like, I got this in like 2 weeks. I know for a fact I will injure myself and be recovering for 6. So you just got to take it slow. Be patient with yourself. But give yourself some real timelines so you can check in and say, did I get there? Ailments. So research versus experience. I volunteer with a nonprofit doing research clinical coordination. So I get to look at research projects and basically tell you how awful they are because they can't account for all the variables. Research can be helpful. There's a statistic out right now, and we all know how we feel about statistics. Less than 2.8% of medical decision-making comes from evidence-based research. Just think about that, 2.8%. So how many times have you gone into the doctor and you think that they're basing it on science? Yeah, so now it is science, it is, but it is practicing medicine. It's the art of helping you help yourself, right? Helping you figure it out moving forward, understanding the complications of some treatments so you don't kill yourself in the journey of getting better. And yet it happens all the time, unfortunately, right? So the research is never going to validate the journey that your patient is going on or that you are going on. The research will never do that because it's not explaining everything outside of what can be captured in a survey. So it's important to keep that in mind when you're moving forward with these types of treatments. Now, research has a place, a very important place. But when it comes to establishing these goals, hitting these goals, moving forward with these goals, it starts to matter a little less. That burden should be on the doctor anyway, right? Let them figure out what research is worth trusting and moving forward. Now, there's always going to be consequence to any therapy. It doesn't matter what you're doing, right? I remember early on, I was in PT and I was military, right? So I got everything. It was beautiful. I got really lucky having the knowledge on the medical side to know what I was going through, to articulate it, to insist on certain things I think most people probably wouldn't have. And I had the military to give me every orthopedic device I could have wanted custom made. Which means I have a lot of devices that are just totally not practical, right? Like I curl up in a ball when I sleep, and then I get these lovely like elbow aches sometimes because you curl up so tight. So they built me these wonderful handmade like elbow sleeping things. No, you don't wear that. No one would wear that to sleep. Okay, I don't need a sleeping problem, but it was nice. Now, they started KT taping me. That's like a military favorite. I adored it. My first time being supported in my life, right? I was like, oh my God, this is what it feels like. Like this is what joint, like staying in, oh, that's awesome. I started developing an actual true anaphylactic reaction to adhesives. So I actually get anaphylactic to any adhesive now, including IV dressings, which is fun to deal with. But everything has a consequence. Thankfully, I discovered the body braid at some point because that was like a non-adhesive, So that was a really nice supplement at that time in my life. But just understand as a doctor, everything you prescribe has this. And as a patient, look out for this stuff, right? I know you want to chase the having everything fixed. And sometimes you need to put a limit and say, you know what, I'll try 5 things. And when those 5 things have failed, I'll try having it for a while, whatever the symptom is, and see if I can focus on a different symptom. Because sometimes the consequence isn't worth the therapy. In this last section of your appointments, if you can confirm the goals or summarize, right, just state back to your doctor, okay, this is my goal, right? Are we on the same page? I think that can help everyone kind of summarize. Also, whatever your last words out, there's been a lot of talk today about documentation, right? About doctors documenting things, which helps everybody. The last part of that conversation you have with them is the most likely to end up in that report. So the more you can hammer that at the last minute, like, okay, I came in to talk about my eyes and my ears, this is what we're gonna do, you're gonna refer me, I'll come back in 6 months, and my goal is that I will be able to do X, Y, Z in the 6 months, right? Having yourself set up for that is gonna be a lot more successful than just coming in kind of without maybe that mindset. So these are the things that as a patient you can really focus on. Setting your goals, focusing them down, defining them, creating that time limit, and confirming them. Now, I just couldn't get enough of the acronym. So Zen expectations, balance real ailments. So we have to respect the zebra in all of us, right, to get there. Now, I will say, so this particular subject of organizing your care, it has meant a lot to me. It will continue to mean a lot to me because there's not ever a time where I've ever been in and things go right, I think is how to say it. Except for when I had my baby girl, they were saying, right, Ehlers-Danlos, no, the delivery is gonna be terrible, it's gonna be impossible. And yet how many people in this room have had babies and had Ehlers-Danlos? I looked at the statistics on it before I had it, and it's actually like no risk. Now obviously vascular type is completely separate. Vascular type has its own risks. Hypermobile type, you have different complications than a normal delivery, but not like you're gonna die, don't have a baby, you can't push the baby out. Nothing like that. And yet there's this medical idea that everybody was so sure of, that it was gonna be so hard and not work. And so going through the process of having my little girl, I'm on a blood treatment called plasmapheresis every other week. She's the first baby born in history who has had that procedure done to her in the womb throughout her whole life. And one thing that did is it put us in a position to not know, like, what's the outcome, you know? She's a girl, she has the hormones. I think based on the science, she shouldn't necessarily, or she should have had weird bones, but she's totally fine. She's very, very healthy. Now, there were complications from me that I don't think anyone saw coming. And this is where I get to the dying with humor part. So for a while, I was undergoing something called autonomic failure. Due to one of the autoimmune conditions I have, I had POTS before. This is a bit more of the blood pressure component. So for about a year, my blood pressure would be in the 60s. I'd be conscious for about a couple hours a day. My heart rate would be in the 150s to 200s. At that point, I'd been told I'd probably have a couple months, just because the stroking implications of having those kind of vitals weren't, you know, and we tried everything. We tried IVIG, sub-QIG, chemotherapy. And then I ended up finding a doctor who was like, hey, I think I know what this is. You know, and he completely changed everything because he put me on the right treatment. I couldn't talk before. Words would get stuck. They called it the tip of the tongue phenomenon, but like everything. You know, and so undergoing that treatment and having that approach of this consistency with providers helping through and staying on top of your medical care in an organized fashion has been priceless. With my little girl, I made a birth plan binder. And I had this little poster. I'm definitely, you could tell, I'm not type A, right? No way. I made a little poster, and I had blue tack, and I like put it up on the wall, you know, like, we will have dim lights, and my music playing, and all this, which was great. Unfortunately, after I delivered her, I had a bleed, which I think the doctors were so afraid that they just didn't want to come in. So like my husband, who's not healthcare, I trained him on how to deliver a baby just in case. Here we are, best hospital in the city, a giant metropolis. No doctors show up when I'm pushing. And I don't know what was going on there, but they end up, you know, he ends up actually catching, crowning, delivering the baby whole 9. And then the doctors show up, and they do the one thing they pull out my placenta, so it ripped, and they didn't catch it. And anyway, so here I am on the bed, and I have a blood pressure at this point, I think of like, it was 50/32. And they're like, okay, well, we have to go do a manual, you know, on you to get everything out. And I was like, well, that means I'm losing more weight, right? And I was full of these jokes. I don't know why. It's just when I get funny. And my poor husband's on the other side with me like bleeding. And all he hears is the doctors laughing, not like me joking. And so I think the poor guy has by proxy trauma from the whole process. But understanding that your supporters go through struggles too. And making sure that you refer them to groups sometimes can be really helpful, because Zebra doesn't just take one, right? It really does take all of us. It is a family, and supporting the family members is really important too. So thank you all, Zebras and Zebra supporters.